We have two long bones in the body. Well, I guess that's not exactly correct. You have four long bones, a left and a right, two of each type. Your femur or thigh bone is a long bone. Your upper arm bone or the humerus is also a long bone. These bones attach the limbs to the trunk of your body. And although they do that in different ways, they do the same thing. Okay, so which one is which here? Which is the femur and which is the humerus? Are those sizes relative? Well, I think so. I fiddled with the sizes until I got what I thought was about right. But yeah, yeah. The bones on the right are larger than the bones on the left. But you should be saying that the femur is on the right. On the right, I mean like correct. Yes. The femur is the two bones that are on the right side of this slide. We know this is the femur, and that's a great place to start. I like to start with the femur because students generally know that this knob here, which is officially called the head, is where the femur fits into the hip, which is also called the coxal bone. Right away, you know that this is the superior end or the top of the bone. This part here is where we have the knee down at the bottom. First thing down, we know the top and the bottom of this bone. That's great. So if you have a skeleton model, most of them allow you to pop the legs off, not the arms, but the legs. I urge you to go get the model's user manual so that you don't permanently break something by removing the legs. I just make sure you're doing it correctly. If you have the physical model, take the right leg off and lay it in front of you. And as you lay the leg in front of you, you might note, the lower leg is attached to it. So, you know which is that it's the right leg, right? But if you were given this picture here, or if you were given a free femur, how would you know if it's a left or a right? Is this picture here a picture of the left and a right femur? Or is this picture of one femur, either the left or the right, and you're looking at the front side and the back side? Well, when we're learning, it's useful to be told that it is a right femur. I want you to know that first off. And you are looking at a picture of the anterior side of the right femur on the left side of your screen. That's in the anatomical position. And you're seeing the posterior side of the right femur on the right side of your screen. Whenever you look at a bone, it's incredibly important to orient it as it would be viewed in the anatomical position, with your patient standing erect with face, palms, and feet forward. This is the picture that I've shown here, but we also have to consider some features on the posterior side of the bone, so I have the front and the back here. Oh, I got one. Just as the head of this figure in the center of the picture is placed on the neck of this person, so is the head of the femur placed on the neck of the femur. Seriously. All right, how did I know which was anterior and posterior? So think about your knee for a minute. What's the name of your kneecap? Yes, the patella. Correct. All right, so I want you to put your hand on your knee, and then I want you to flex and extend your knee, moving the bottom part of your leg away from your hand to the body. As you move your knee, you can feel the movement of your patella along the femur. The movement of the patella creates a very smooth surface called the patellar surface. And this surface is only on the anterior side of the bone. Take a look at your specimen that you have in front of you, the physical model, and take a look at the picture here to see the smooth surface of the patellar surface on the anterior side of the bone. On the posterior side of the bone is a very deep depression called a fossa. This fossa is called the intercondylar fossa. Why would somebody name it like that? Well, because it's in between these two big knobs that you have here, and those two big knobs are called condyles. So this depression, called a fossa, is between these two knobs called condyles, and thus it's the intercondylar fossa. Oh, that makes so much sense now, right? Note how different it is that the patellar surface is very different than the intercondylar fossa. And you may have to explore your physical model to see those differences and feel them. This is how you can say to yourself, this is the front or the anterior of this bone. This is the back or the posterior of this bone. I told you that this was a right femur, but again, if you were to just get a femur, how would you tell if it's the right or left? All right, have you ever been boating? Have you ever seen a movie where they drop a body off from a boat in a lake? Well, to remember where you are in a lake, you have to fix your location from 2 points. You can't just look at shore and say, oh, this is where I am. You have to look into 2 directions and then say, this is where we are. This is the same with bones. You can't just know the front and the back, or if it's just a left or a right. You have to put those 2 directions together to figure out your bone and orient it in the correct anatomical position in front of you. We can use what we've generally learned about the ball and socket joint of the hip to figure out if a bone is a left or a right. Now that we know the patellar surface faces forward, or it's on the anterior side of the bone, we can test out whether the bone would be a left or a right using the orientation of the hip. Another way of saying this is that I know, and you know, that the head of the femur will be medial, not lateral. If you have a skeleton in front of you, I urge you to remove both legs and play around with these 2 types of directions and see how the leg just does not fit into the skeleton in a backwards or in a flipped orientation. All right, so now that we have which side of the bone is which and which side's anterior, posterior, up and down, all that good stuff, we can fill in some of the gaps about some of the condyles. So you can, in very severe injuries, break condyles off your bones. If you broke your condyle off your femur, someone might ask you, well, which one? You have 2 condyles on one femur. How do you tell them apart? Well, the medial condyle is on the side with the head, right? The head is medial, fits into the body. Therefore, the medial condyle is on the same side. I have a really good trick for remembering the lateral condyle. It's not on the side of the head. Hey, keep it simple. All right, there's just 3 more features. Just 3 more features. The first 2 features are on the proximal portion of the bone, or the portion that is closer to the body. And this is the head area. I want you now to know that for long bones and stick bones, the proximal part is always the head, always. Here, we have these projections that are rough and somewhat pointy, kind of. And they're definitely not like the rounded condyles. These are trochanters, a word which means to run. These are attachment points for the ligaments of your large hip and quadricep muscles. The greater trochanter is on the superior side of the neck, whereas the lesser trochanter is inferior to the head and neck completely. Be sure that you're looking at your model. Don't just look at these slides. It's important to recognize these from both sides of the bone, anterior and posterior. You can see all trochanters from all angles. Visible only on the posterior side, however, is a feature called the linea aspera. This, as well, is an attachment point for muscles.